Hello, my name is Hunter Hutchings, and this is my group project interview. I am doing it solo, and the subject that I chose is going to be health psychology. I have an attachment to health psychology. I see a health psychologist myself, and it is part of the reason why I want to go into the field and find it extremely interesting. I have been inspired and really care about people who deal with chronic health issues and many other diseases and veterans, and don't think that they all necessarily get the mental health that they may need to adjust to different situations with their diseases, or their quality of life is pretty low because they don't have access to the help they need. And so this is a really big concern for me, and so I decided to get involved and am now pursuing it myself. So, a little bit about health psychology. It was actually founded in the 1950s, and it began to get more popular around the 1970s. It was founded by George L. Engel, and he came up with the biopsychosocial model of health, as they call it, which is a framework that states the interactions between biological, psychological, and social factors determine the cause and manifestation and outcome of wellness and disease. So, and that basically means they were getting more of a focus on how people reacted with diseases, what, environmental factors had on that, maybe what biological factors played into it. There's a lot of different things that can kind of, relate to wellness, and especially whenever it comes to different diseases. And they really didn't know much about it at the time, so it was really exciting whenever they finally started to delve more into it. Whenever they were getting more into it in the 70s, it was because there was a growing understanding in medicine and the effect of behavior on health. So people really started getting more interested in that. So that is kind of where it came from. And eventually it became its own branch of the American Psychological Association, and it's the Division of Health Psychology. So that was really exciting. So some more descriptions of what health psychology is and more things that are involved with it is it's really involved with people's well-being and how it's impacted by biological, psychological, and social impacts, and different factors that have to do with that and how they play on health. They really focus on individuals who have particular diseases, especially dealing with maybe more chronic pain or even things like cancer. Honestly, it's such a wide variety of things and specialties that it can really be broken down. They work in all sorts of places, including the oncology department, pain management, women's health, anti-smoking are just a few of the kind of different ones. A lot of the times you'll see them in hospitals. I've seen ones that have their own private practice. It kind of just depends, and the good thing about health psychology is there's a lot of different options with the things you can do and the career paths you can take. They really help people with chronic illnesses and do different therapies to really help them. They help with pain relief and stress relief. They really want to improve the quality of life and increase, say, mobility if you have pain or anything like that. They really, are focused on like what the disease does, how can you get, effective help, like what can you do to make it better and improve the quality of life. and they really, focus and hone in on that and look at all the factors that may be contributing to the illness and maybe making it worse. So the degree required for practice in the field is going to be a doctoral degree, and it's going to be in either clinical or counseling psychology. You must also complete a 1-year internship or residency specializing in health psychology, and you must have trained in that as well. And it must also be completed from the actual American Psychological Association, and it must be accredited through them. Extra work may be required, but it depends on the actual university itself. They must also get specific licensing as well. It's really dependent on the state. Usually, as long as they have a graduate degree and can pass their exam, they can go ahead and get certain licenses within the state, but most of the time it needs to be completed at a doctoral level though. So there are 5 different places that a student can be trained when hoping to become a health psychologist. One of the most common is hospitals. I mean, there's so many cases you can do there, so many different departments. Honestly, the possibilities are endless. It kind of just depends on where you want to specialize and perhaps, who you may be working with, depending on where you may end up. Another place they can be trained is rehab centers, which is really nice because, there's a lot in the area. It really helps people to get, more in-depth training. It really helps with seeing the psychological side of things, say, maybe substance abuse or, anything like that, having to deal with addiction or just bad habits, honestly, that people need to break. And so they get a first-hand look at that, and that really helps them develop those skills. Another place is a private practice. I did not even know that health psychologists could have their own private practice until I went and saw a health psychologist myself. That kind of inspired me to want my own practice, so that way I can have, more pull on how I treat my patients and kind of be my own boss. But private practices are excellent for students because you get more one-on-one training. It's in a maybe a more settled environment. Maybe it's not as busy as a hospital. So it probably helps them develop more skills on a personal level with patients. Another place students can train also is at universities. I mean, obviously, if they have a health psychology department there, they can be trained. If not, they can be trained in any medical area that the university may have, or even in the psychology department itself, just depending on what's available. But there's definitely a lot of options for them there. Let's see, another place they can go to is entering federal run programs. So say there's, maybe they can train with the police, or maybe they can train with, different areas, maybe through the Army or something, kind of depending on where they're at. If they need, an internship or something through there, they can get plenty of good resources for training, as long as, it's a certain area, and I assume they have permission. It probably takes quite a bit of permission to get into the federal programs. And so for continuing their education and keeping up against the standards, health psychologists are required to have licenses provided by the state. So most of the time, if they're going to be a clinical health psychologist, they'll be licensed through that, but most of the time they just need a generic psychologist license that they can get through professionals. But most of the time, they only want people who are getting that license to stick within the areas of which they are familiar and have more expertise in. But I believe health psychology is such a broad field that they probably would not have a problem finding a job or finding areas in which they have expertise and which jobs are available. They also need to obtain formal training as well, and then they also must pass an exam that is given by the board as well, and so they must pass that in addition to having their licenses as well. They may need other licenses too, depending on the state or depending on what area they want to actually go into. But most of the time, they just need a general license and then probably to pass the exam. And as long as they know what area of focus they want to go into, it shouldn't be a problem for them, and they should be able to start practicing. They also need experience in postgraduate programs, especially in clinical health psychology. So a lot of the times they will need to go and actually take an accredited program and complete that, and it has to be accredited by the American Psychological Association, or it's not valid and they won't get the credit. So that's another necessary step for completing the licensing as well. So some typical settings used for practice in the field of health psychology are honestly extremely vast. There's many areas you can go to depending on what you're interested in. A lot of the most common ones are going to be hospitals, because there's definitely enough to do around there. You can get into so many different areas in just one place. It's kind of crazy. They can have their own private practices as therapists and see their own patients for issues as well, which is what I would like to go into. They can also be in rehab centers where they're extremely beneficial with helping people with addiction issues and other illnesses they may have that are affecting their life. They can be at pain prevention centers. One of their biggest areas of focus is chronic pain and helping patients with that as well. That's extremely my big focus too. They can be at other therapist offices, even just normal counseling centers, helping people. They can even do normal counseling themselves if they wish. They are going to be at oncology centers, helping people who have just been diagnosed with cancer and may be, wondering what their next step is or how they're going to go about living with the quality of life they've been given or the time they have left. And the health psychologists really help with focusing on their pain and making sure they have the best quality of life possible while they are either recovering or, have however much time left. They can also be in public school settings, helping children who have illnesses, or maybe even the employees. They can help with counseling services and, really helping people in those kinds of settings too. That one's not as common, but it's still a pretty wide area though. Speaking of schools, universities are always a big one, helping students that have health issues or working in the psychology department themselves, helping, run research, study tests, do all sorts of different things that may have to deal with health and testing for that and doing new research. They can also be in nursing homes, helping people that are aging, if they have different illnesses they're dealing with or just their quality of life as they're aging as well, helping them get into a better place and hopefully progress and stay as healthy as possible for as long as they can. they can also do private home care as well, where they come to a home and give therapy sessions and do different types of treatments as well. Sometimes it's massage, sometimes, it's just stress relief, or it's just, good old fashioned talking and discussing symptoms. But it really helps though. And private home care is actually one that I don't really think of that often, or that people may not think of, but it's actually a pretty big area though. So the typical range of annual earnings for a health psychologist is going to be about $75,000 to about $100,000, with about $40,000 being the lowest that they make and $100,000 being the highest they make. Most will make around an average of $97,000 a year, which sounds pretty good to me, honestly. However, health psychologists who work in a more community setting, such as a nonprofit or public mental health facility, may tend to earn less than their counterparts that work in academia or a more professional setting, such as a private practice or a government setting as well. And it is said that those who are a consultant or work in their own clinical private practice will make the most money and earn around the $100,000 mark per year. So I found a few more sources that I thought were interesting. So the first one is actually a magazine that focuses primarily on health psychology. It's a monthly subscription written by a doctor that's a health psychologist. It talks about health psychology and many different areas within that and the current research that's going on within it. It is actually the official scientific journal of health psychology, and it is run through the American Psychological Association's website. The second resource I found interesting is the website for societyforhealthpsychology.org. It's one of the official sites for the actual Society for Health Psychology, so it's completely official. They have a lot of the information. They'll send you out a newsletter every month with current information. They, consult each other. They have talks every month and meetings. They also have the magazine from the American Psychological Association. That's the official health psychology magazine. You can get that as part of your subscription as well, and that's something they offer too. So if you want like a little two-in-one, that's a good one. They also offer a lot of information on the origins of health psychology and the different areas it touches on as well. It's extremely fascinating and it's a really good resource. Another website I found that probably has the most information if you just want to learn almost everything there is to learn about health psychology is going to be healthpsychology.org. It tells about all the different branches and really breaks it down into how, it is integrated with health psychology, what the health psychologists do in those different branches, what their practices are, where they may work. It's extremely fascinating. It also offers, just what health psychology is, looks more, in depth at the history of it, how it is today, what all research is going on. I just found it extremely helpful with all my research, and it actually taught me some things that I did not even know and really just was a helpful tool whenever I was researching. So I think that is a good one for further research. So I had 4 sources for my project. One was study.com, and it was health psychologist job description, duties, and requirements. The next one was psychology.org. The next one was verywellminded.com, and the last one was societyforhealthpsychology.org. Oh, and I also used psychologyschoolguide.net as well.